Okay, we are streaming live and we'll get going formally in a couple of minutes or so. Okay, I have 1:15 here, and we'll go ahead and formally get started. I am Chuck Carney, Director of Media Relations and Spokesperson for Indiana University. And as you can see, we are doing the Wear It B-Town challenge here as we are showing solidarity, those of us, the particular speaking here today. So that's why we're starting with this. I am only in here with my miniature dachshund, so there's nobody much to protect from me, but I am wearing it, and I do wear it when I go out at all in town. But we are here for our regular weekly news conference, again with Bloomington Mayor John Hamilton. We have Monroe County Commissioner Julie Thomas, Marianne Valenta, Regional Director of Alignment and Integration for Indiana University Health, Monroe County Health Department Administrator Penny Cottle, Monroe County Emergency Management Director Allison Moore, and IU Assistant Vice President for Strategic Partnerships, Kirk White. We'll start off with Bloomington Mayor John Hamilton.
Thank you very much, Chuck. It's good to see everybody. We're wearing these to demonstrate the importance. I am going to take them off since I'm in my home alone too now, but please do wear masks. They save lives. We know that. It's good to be together with everybody again. A couple quick non-COVID announcements maybe. Farmers Market is changing again. We really appreciate the collaboration with the health department. We're going to be allowing some in-person shopping at the farmers market this coming Saturday, still limited to 75 people. It's still going to be quite a different market from what we saw the past years, but we look forward to that. City Hall opened this week to public. Again, we've been closed for public visits for 4 weeks while every city employee kept working, but we opened for this week. Though I have to say, for the most mundane reason, City Hall is not open today because the air conditioning broke. So we're fixing that, but that's a reason we'll take. Lastly, please do vote. The election comes on Tuesday, and it's really important for everybody, either remotely, as you know, or in person, early or in person on Tuesday the 2nd. I know you'll hear a lot about the review of local health data. That's good. That's going on. We've got a lot of good signals locally in terms of hospitalizations, in terms of the incidents, which we like to keep seeing. We're hopeful. I continue to be worried about what's coming. We know there are changes coming, both in our community as our population changes, and with the announcements from IU this week, which was very good to hear. Their very intentional and careful plan. Will be working closely with them as the city to look at those changes and what they will mean for our community coming forward at the end of the summer. As well as we know communities, the health data is going to keep evolving. We hear experts advising many things. So I continue to be cautious. I want to take things very carefully on behalf of the residents of Bloomington to be better safe than sorry, and knowing that we can continue to take very important steps of physical distancing and masks when you are not more than 6 feet away from other people. We're requiring it in City Hall, and I know many people also are. Please do continue to follow those very, very important guidelines. When you wear a mask, mostly what you're doing is you're protecting other people. So we need that for each other. And I'll hand it back to you, Chuck. Thanks.
All right, thanks very much. And an important note, if you vote absentee, I didn't know until this year, you get still a sticker. That was an important point for me. I have to get that when voting. So let's go to Monroe County Commissioner Julie Thomas.
Thank you, Chuck. Thanks everyone for being here. I just wanted to again thank everyone on the front lines during this pandemic and all the hard work everyone's done. For Monroe County government, beginning June 1, we are moving to a less restrictive continuity of operations plan level 3. And we're going to continue to utilize flexible scheduling, remote work for our staff. Beginning June 15th, some of the buildings that have been closed to the public will be reopening, but by appointment only. And we're also going to be resuming our board and commission meetings via Zoom starting June 15th. We have adapted to the new circumstances without interrupting government operations, and residents who need to contact any Monroe County department are encouraged to call or email the relevant office for assistance. Indeed, if you have received a mail-in ballot and you've not returned it yet, you may actually drop it off at Election Central on 7th and Madison. And a reminder to everyone to please wear your face covering. It is a sign of caring and respect for our community. And practice social distancing, wash your hands. If you're not well, stay home and get tested. We have given grants totaling almost $198,000 to 25 businesses in the county outside the city of Bloomington who are engaged in some form of tourism, and that comes from the Food and Beverage Fund. And we are still accepting applications, but that window of opportunity is closing with the governor's order set to lapse at the end of June. So anyone is welcome to apply. If you're a business outside the city of Bloomington and you're involved in some way in tourism, go to co.monroe.in.us. Also at our main website, you can find the megaphone icon on the middle banner, and you can click and sign up for resident alerts. And this is not only for severe weather, but our health orders are going out to everybody. You may choose to receive information via email, phone call, or text. And with that, I'll waive any questions. Thanks, everyone.
Okay. Marianne Valenta with IU Health next. Oh, need you to unmute, Marianne.
Thanks. Happy to join you today as Brian Shoffney enjoys a well-deserved day off. We have continued to see very favorable hospitalization trends. And so this week, we want to focus on 3 messages to you. One around the next normal, the other are virtual screening, and then maintaining mental and physical health. So the next normal, we are very cautiously and intentionally reopening our physician practices, but the experience there is going to be different. And so we want people to know that every precaution is being taken, but patients will be asked to wear a mask. We will provide that mask to them if they do not come to the office with one. Our providers and staff will all be wearing masks as well. Patients will also be screened for COVID-19 symptoms before entering the building. And we're working hard to significantly decrease wait times in the offices. We're doing this by scheduling appointments further apart. if there is a possibility that you have to wait, all of the waiting areas have been reconfigured so that social distancing is maintained. Regarding virtual screenings, one of the things that we've learned through this is that our virtual screenings are very much preferred by our patients for a variety of reasons, not having to travel, not having to wait, having a much more efficient and direct relationship with their provider. Those will continue, and probably for the future as well. We have no intention of ramping those down. If anything, we're ramping those up. And then finally, just some comments. We all talk about the social distancing, the mask, the hand washing, and all of that. But we also know that the mental health issues are a concern. We've heard that before. We want to encourage people to get a minimum of 7 to 8 hours sleep, to eat and exercise regularly, and to not hesitate to reach out to their physician or mental health provider if they feel that they need support. So thank you. Then I will be here for questions.
Okay, thank you, Mary Ann. Let's go to Monroe County Health Department Administrator Penny Cottle.
Thanks, Chuck, and thanks, Mary Ann. You said lots of things that we want everybody to continue to do, and glad that we're all moving forward, right? I want to start just a little bit with some of our routine things at the health department. We want to encourage people to keep and maintain those routine medical appointments now that things are opening up and we can go back to those. And especially make sure that if any vaccinations, routine vaccinations have been missed, that those are made up. The Monroe County Public Health Clinic number is 812-353-3244, and an appointment can be made for vaccinations. The American Academy of Pediatrics is launching a new campaign that's urging immunizations not fall behind during this pandemic. Another thing that I wanted to bring up is that families who are receiving free and reduced school meals, there is pandemic program to help them during this time when schools, for example, are closed, and there's no application needed. So if people are receiving those benefits, then their card will automatically be mailed to them, or they will be added to their SNAP benefits automatically. So we encourage people to make sure that they're receiving that. The Monroe County Community Organizations Against Disasters, the COAD, did launch their face covering campaign on Monday. And we ask again that everyone join us in that. And kind of when you post those pictures of you and your face covering, use hashtag #WearItBtown and hashtag #WearItMOCOs for Monroe County. Take the pledge as well to maintain the social distancing, to use your face covering when you're in public and can't maintain that distance, to avoid touching your face to your hand, your face to your hands, your hands to your face and your eyes, and washing your hands well and often. And again, staying home if you're sick and getting tested. Our staff at the health department have continued to provide routine services in new and innovative ways, in addition to responding to COVID-19. So those are some of the routine things that I wanted to report on. And obviously everybody's probably most interested in the newest health order, which goes into effect tomorrow. And the primary difference for this order, we will essentially be joining the Governor Holcomb's order for stage 3 for the state of Indiana with an exception. And the exception is that Monroe County is carving out its limit to mass gatherings to no more than 50 people. So that's the big difference. And you can kind of check our order out. You can check the governor's order out for very specific details about that. But we feel like because our numbers are doing well, as Mary Ann talked about, the hospitalizations and the emergency room and our ventilator capacity, all of those things are much improved and holding very stable. The influenza-like illness and COVID-like illnesses that are being reported are down. Our numbers, even though we continue to add some cases on a daily basis, 1 or 2 a day, it seems, Our percentage of cases in terms of the number of people being tested continues to drop. And this morning it was 5.3%. So those things are encouraging to us. But I have to remind everybody, how did we get here? We got here because we followed the directions of our health experts and the guidance from the CDC and our state health commissioner and our local health commissioner. And we need to maintain our social distancing. We need to wear the face coverings when we're in public, and we can't maintain that distance. Washing our hands, all of those things we keep repeating are how we got here. But it's also why we're moving slowly. We don't want to rush things, but we are following the state. We're a little behind them. So we can watch and see how things go with their numbers as also a guide for our numbers. So we are moving forward. I do want to highlight just a few things that seem to be confusing to people. But I will remind you that the state health, the governor's website has his stages and the directions and the requirements all listed. So again, a gathering size is a social gathering, a mass gathering, it's a party, it's an event. It's those kinds of things where we get together, and usually that social distancing is more difficult to maintain. So those are limited to no more than 50 people. It also includes receptions and visitation at a funeral or meals, those kinds of things. So we've had questions about religious services. The governor carved out religious services, so a wedding, a funeral, a worship service is not subject to that mass gathering limit. However, everything that goes around that, the reception, the visitation, the meals, the gatherings or the meetings around that are subject to that 50% limit. The other thing that I would say is the governor and local officials here would encourage faith communities to not meet in large groups inside yet. Even though they may, we would encourage them not to do that. Hold off, use streaming or whatever other services you've been able to do as long as you possibly can. But there is specific guidance for worship services and things that need to be in place. Again, social distancing, additional cleaning, not using, passing out your normal handouts, your programs. Thank you. I'm looking for the right word there. Those kinds of things, because we want to be very careful. I know in my own church that the vast majority of people are in a high risk category. So bringing everyone back in that environment could put people at risk. So we encourage people to use caution. I know that there have been many denominations that have reported to us that they don't intend to come back in person at least until later June or July. They want to see how things unfold first into those large gatherings. So I just wanted to try to clarify that a little bit. With this new order, gyms may open with restrictions, and bars and nightclubs remain closed. Playgrounds remain closed. Swimming pools, public and semi-public pools may open, but they do have restrictions as well. And there are about 6 pages of guidance for swimming pools. So there's CDC guidance out there. They are limited in capacity. They have to maintain social distancing. And again, we encourage everyone to wear those face coverings. There are many businesses that their employees are required to wear them. And so they are wearing them to protect their colleagues and to protect you as a patron. And most of those businesses are asking that the patrons wear them as well. And we would encourage everybody to comply and do that. Give those employees the same respect that they are giving you by wearing those. We are following up on complaints that we are getting on places that are not wearing them when they're required to. We will continue to do that. But we also know that and believe that people will most often do the right thing. And that's why we have the Wear It B-Town, Wear It MoCo campaign going, and are encouraging people to take responsibility and care for one another by wearing their face covering so that we don't have to make some mandate and then try to enforce it. It's very difficult for enforcement for everything. And some people can't wear a face covering, so maybe they'll find a shield. We would encourage them to, come up with a face shield that they might be able to wear instead. But we want to be mindful of those things, and enforcement is certainly an issue. But every business has the right and the capacity to require those face coverings, and we support them in doing that, and we encourage them to do that. Monroe County government is requiring them in their buildings. Mary Ann, you mentioned that your offices will require them as well and are requiring them. I think City Hall is requiring them, but every business, every swimming pool, there are requirements for face coverings at swimming pools. But if you own a business, we would encourage you to make that a requirement. And we would respectfully ask that everybody comply with that. I think that's it.
Okay. All right. Let's next go to Allison Moore.
Thank you, Chuck. I don't know if you can see or not, but I have pigs. I'm a pig farmer on the side beyond my emergency management duties. And so a friend of mine gifted me with this mask, and I am super blessed that I get to protect those around me due to my friend that gifted me with this mask. I've actually gotten lots of masks from various friends. And so if you're looking for the perfect gift for a friend or a colleague, this might be an option this time and era that we're in. So kind of a fun little thing there. We do have a blood drive scheduled through the Monroe County government, through the Board of Commissioners. It is going to be at the Bloomington Convention Center. It's scheduled for June 23rd. And you can, I literally just now got the flyer on this. So we will be putting this up on our county website this afternoon. It's not currently there, but will be. You can call and make an appointment for that. And that's how we're going to be able to keep our social distancing and still get the many people, hopefully, that will sign up. They do anticipate us to be in a dire shortage around the end of June, beginning of July. So we ask that you consider going. You can call 1-800-RED-CROSS, and the code to get an appointment for this particular site is Monroe County. There also is a website, redcrossblood.org, and then you can then search in the search engine Monroe County, and you'll see the Bloomington Convention Center, where you can go and then select a time for you to, in fact, register by appointment to go and make that donation. And all that information will be later on our website later today. We are getting another drop of PPE equipment from the Indiana Department of Homeland Security. We anticipate that drop to happen next week. You may be questioning why now, as numbers are good and things are great. Why are you accepting a drop now for our first responders? But I want the public to know that we started with a stockpile that many counties in the state of Indiana did not have. And we were very lucky that our emergency management office and our health department and some of our first responders were very proactive in having supplies and PPE for our healthcare workers, our long-term care facilities, and various other partners beyond first responders in the county that we were able to share our PPE supplies with. And due to all of the needs that we've had, that stockpile is now very, very low. And so by getting this other drop, we'll be able to hopefully meet the needs that might come right now, today or next week. But then if something else happens, or we do in fact get a second wave, we will be more prepared for that. And so I want the public to know that we are already thinking ahead in hopes that that doesn't happen. But we are making those requests and getting those supplies in and getting things organized now as things are starting to become more normal and more calm, so that we will be best prepared in Monroe County for if and when something does happen. And so we're excited about that drop so that we can be prepared for that. We did deliver 1,000 surgical masks to election center yesterday. So if you are someone that is kind of sitting on the fence, I really want to go vote, but I don't have a mask, or I'm not sure if I'm safe, I encourage you to go and vote, and let you know that there are supplies there and there are masks at every voting site that you can quickly put on as soon as you go in. That will keep our volunteers safe, and then that will also protect yourself as well. So if you're thinking about it, but you don't have those supplies, know that they're there for you, and we were happy to provide those for anyone that may wish to go vote next Tuesday. And then the last thing I wanted to say is, as we are moving forward, our first responders are moving forward also. They're starting, not that they had a hold on any of their trainings, they continue to be up to par in all of their standards, but they are in fact starting some of that basic training again, that they had to kind of switch gears and do things a little differently. And their trainings, of course, now are a little different too, but rest assured that your first responders are in fact continuing to meet those standards through all of this, and they are now in fact starting some of their basic trainings again as well. And so I just want the public to know they should be so proud of their first responders, as I know I am. So that's my report today. Thank you, Chuck.
Okay, and reporting from Indiana University, Assistant Vice President for Strategic Partnerships, Kirk White.
Thanks, Chuck. Well, it was a busy week for IU. We've started our phased approach to reopening the campus. On the 1st of June next week, we expect to resume research operations that were stopped during the COVID situation. And we're distributing PPE to the faculty and graduate staff, graduate students that'll be restarting that research next week. I think everybody knows that we announced the new academic year calendar, which in highlight form will start on August 24th and run through 20 December for the fall semester. However, classes will only operate online after November the 20th and up through the 8th of February, which allows us to have a new winter session, which will be the 30th of November through the 7th of February. Spring semester will start on the 19th of January and run through the 9th of May, but online courses only, online instruction only until the 9th of February. This will continue along with this concept of hybrid face-to-face and online instruction that we think will be successful for us this next year. But all this depends on the current situation that as it unfolds with our health metrics as the summer progresses and into the fall. A big piece of all this for us is an education campaign for our students, faculty, and staff, and we're working on the elements of that now. Right now, in fact, we're working on a public service announcement that will explain the importance of face coverings for all of our university community. And I would just encourage everybody as they want to get up to date on the latest. We're keeping a next academic year website up to date on a daily basis. It is fall2020.iu.edu. That's fall2020.iu.edu, where we'll have the latest updates on the next academic year and how we're going to kick things off for fall. And that's all I have for today.
All right. Thank you very much, Kirk. So we'll jump into questions. First of all, from Ethan Burks from WFIU, WTIU. For Penny, how will the increase of group gatherings affect the success rate of contact tracing?
I guess the answer to that, it depends on how much people wear face coverings and how much they practice social distancing and the hand washing. Whether we're in a group of 25 or 50 or 100, we still need to be practicing those things. We need to be staying home if we're sick so that we're not knowingly putting somebody else at risk. If we were to have increased in cases, certainly, then the people who are doing the contact tracing will have more people to follow up on. But the state certainly has ramped up the number of people that they have available to do that and are continuing on a weekly basis to report enhancements to the program and to the training that those people have. So I feel like that we're equipped to do that locally. The public health nurses would continue to follow up if there are specific hotspots, businesses need assistance, and there's a state industrial team that can come out and help local businesses if they're having several employees who are infected or something like that. So I think having those contact tracers and the system in place that can help us flag potential groups of people or hotspots will enhance our ability to respond directly to those instead of perhaps closing everything down. We can be very strategic in how we address that.
Okay, next question for Penny or Mary Ann. Has there been a change in the number of children coming in for standard vaccinations during the pandemic? Are parents saying they're afraid to come in because of COVID?
Well, I don't have the numbers from our public health nurses specifically with me, but I will tell you that they are making appointments and people are coming in. Certainly for a while, those appointments were much more limited and restricted and people, weren't coming in. But I think that people are beginning to come back in. And again, we just want to encourage people not to forget about those vaccinations, get them done. One of the big changes with the stay-at-home orders and schools closing is normally we would have been spending the spring, the public health nurses would have been doing vaccinations in the schools. And so they weren't able to do that. And so that is something that we have to catch up on over the summer.
Yeah, I think I would just add from our Southern Indiana Physicians Pediatricians Office, they were very intentional about encouraging parents to not cancel well checks and well visits. And as you know, many times that's when the vaccinations are provided. So they assured the parents that it was a safe environment. And of course, we had all the PPE precautions as well. So I don't have specific numbers, but I've not heard that was a concern.
Okay, this one from Emily Ernsberger from the Herald Times for Penny Cottle. Now that new types of businesses can reopen, such as gyms, are those businesses supposed to post safety plans like restaurants were in stage 2?
All businesses have to have a plan in place. And so it is supposed to be available. There isn't a specific, it has to be posted at it doesn't have to be sent to the health department or to the governor's office, but they do have to have one and it does have to be available. And that's across the board for all the businesses.
Okay, and this one also for Penny. Are there any updates on the OptumServe site's first week?
They did have some challenges, as you know, with it opening, but to my knowledge, they are up. They are seeing good numbers. I think, they have the capacity to see over 100 people a day, and they've had appointments that have been up in that range, I believe. Again, we're not running the site itself, so I don't have those specific numbers, but the reports are that it is up and it's going, and I think they're smoothing out any kinks that they had initially.
Okay. Dave Askins has some questions that I think he's going to post here vocally.
Indeed. Thanks, Chuck. First question, I'm just going to ask all the questions in a row. There's 3 of them as opposed to waiting and then going through that rigmarole. So the first question is for Commissioner Thomas. You mentioned that something about the resumption of commissioner meetings in the middle of June. And so I'm hoping you can clarify if those meetings are going to be in-person commissioner meetings, or if they're going to continue to be facilitated by Zoom, or if there's going to be some kind of combination in-person meeting with an added Zoom portal for public access. And then the general question related to that topic, whenever they do start happening in person, even if it's not in the middle of June, is there a plan to keep public access to meetings through Zoom, even though the meetings themselves are in person and someone could actually show up in person? So that's the first question. Second question for Penny Cottle about the idea of presumed positive cases in local long-term care facilities. So in at least some facilities, these facilities aggregate confirmed positives and presumed positives into a single category and report them to the families. And they're pretty substantial numbers, so I assume that a lot of those numbers in that aggregated category are in fact presumed positives and not confirmed positives. So I guess my question is, are those presumed positive aggregate numbers shared with the county health department? And if so, do those presumed positives in long-term care facilities here locally factor at all into decision-making about the health orders? Also related, that's the second question, by the way. And then the final and third question, there was a situation, I guess, out at the so-called party barn sometime over the weekend involving a large gathering. And I'm wondering if that specific incident contributed or factored in any way into the decision-making in the current order to limit gatherings to just 50 people. I guess really this is a way of asking, is it the party barn's fault that we still have this restriction on gathering size? Thanks.
Okay, so go to Commissioner Thomas for this first question. If you
Sure. Sorry, I added a new filter to my mask and I may have been a little muffled, so I apologize for that. The board and commission meetings will begin again on June 15th. Commissioners have been meeting every week, as we always have. Those board and commissioner meetings will take place on Zoom. So if you're on a board or commission, just contact your chair. They're working with our commissioner's office to make the arrangements, and we're hosting all of the Zoom meetings through technical services. Our commissioner meetings will continue on Zoom. We take the advice of the public access counselor for the state of Indiana regarding when we can no longer do that as the only means of having a meeting. And once we do have to have people in place, it may be that all three of us have to be present, and maybe only one of us has to be in the building. We'll have to see what the public access counselor tells us. Our legal office is working with them directly. But we do really like the fact that having moved to Zoom, that we have really pretty good attendance at our meetings. So we are actively considering keeping a Zoom component to our meetings, even if we go back to having to have in-person meetings, that we could keep a Zoom component going. And right now, our Nat U Hill room, the historic courthouse, is being renovated to ensure that the audio and video will be exactly what's needed for continuing this platform. It's great. The more we can do to reach the public, the better. Thanks for the question, Dave.
okay, and Penny, we'll go to you for these next questions.
The next two, I'm gonna go in reverse order, I think. We did get a complaint about kind of the party barn, and that was investigated. It did not factor into our decision, although specifically, it is not their fault, but those are pieces of information. You asked about numbers. We look at all the information that we have as we look forward to making decisions on how we move forward. So all of those things factor in, but no one thing makes that determination, Dave. In terms of the presumed positives, and this is a term that I think is just very confusing to people. I think that what you're referring to are probably people who have maybe tested, or they think that their test is pending. So they're presuming that they're positive, maybe based on symptoms or something like that. There are people of interest that are investigated and reported to the state. We don't necessarily get those directly. If they're a confirmed case, then that's when those are followed up on with the contact tracers and or the public health nurses. We do have contact with our long-term care facilities and our group homes and various congregate settings to ensure that they have adequate PPE those kinds of things that they need. And, you know, I have to say that I feel like by and large, they have all done a fabulous job when we have talked to them, and all the reports that I get is that they're doing a good job, and congregate settings are difficult settings, and certainly long-term care facilities have people with chronic health conditions, and those can be challenging when you have people who are sick, whether you think it's COVID and it is, or whether you think it might be and it isn't. Those are always difficult circumstances.
Okay, and I think Dave may have a follow-up question. I see the blue electronic hand being held up.
I apologize, Chuck. I forgot to lower that.
So no follow-up question?
That's correct. No follow-up question.
Okay. Well, I am seeing no more questions at the moment, but I'll give it a second here since we still have a few minutes. At this point, the biggest revelation is 21 years in this town, and I've never heard of the Party Barn. So I seem to be behind the times. So, but I will ask if there are any other questions. You can ask them here or post them on the Zoom chat. Well, going once and going twice. We will continue, of course, to do this again next week, and as needed moving forward. It will be probably again an eventful week, as all of these have been. I have heard that these have been helpful, and they have certainly been a lot of news every week, as we've had numerous developments as this continues on. So I think, given no other questions, we will go ahead and wrap it up there. We will again be back next time, next week at 1:15 again. We will see you then.
Thanks, Chuck.
Thank you.
Thank you.
Thank you. Everyone be well.
Have a good weekend.